straight. So there you've got full extension. So she's got a full range of movement. Yeah? While you're in that position, you're then going to move on to the special tests of the ligaments of the knee. So testing the medial collateral and the lateral collateral. So there are some valgus force with the knee in full extension, and there shouldn't be any significant play in full extension. You then do the same thing with a little bit of flexion, and you should find there is a little bit of play, a little bit, a couple of degrees of movement. Okay? While you're there, in that position, you do a Lockman's. So Lockman's, you immobilise the femur, you hold the tibia, and you pull up. And what you're feeling for is a sharp anterior movement. You're feeling for how much the tibia comes forward and whether there is a clear, sharp end point to that movement, whether it goes thunk, okay? And you ask the patient to go. It's hard to describe, but they can tell you what it is. You feel that sort of snap tight inside your neck. If they say it did, that means that the ACL is still attached at both ends. It might be stretched out, if it comes forward a lot and then snaps tight, but it's still there, okay? The stretched out ACL may not function, might still need to be reconstructed, but you're saying, yes, there is something there, and then you're evaluating how much it came forward, and then you compare to the other side. Because if this one goes donk at 7 millimetres and that one does it at 2 millimetres, you know that this is stretched out. Your real good diagnostic test for your ACL is your pivot shift, which is a difficult test to do. It's a little bit involved, takes practice, and it's difficult if the patient won't relax. I'll show you how to do it. You axially load, so you can do that by putting the foot on your hip if you want to, like in a big guy. So you're putting axial load on it. Then as you're doing that, you have a hand here, you're putting valgus load on it, and then you're internally rotating. With it in that position, you're flexing and you're feeling for the knee popping. Okay? And you're feeling for the patient, and you're waiting for the patient to tell you, yes, that's my knee feels horrible, I'm staying. Okay? So that's the pivot shift. Any questions on that?
If it's positive, what does it mean? Just